Welcome to the MediByte channel. I'm your host, and as a healthcare professional, I'm really excited to dive into today's explainer. We are tackling a topic that affects literally millions of women worldwide, yet it so often goes totally undiscussed just because of some unnecessary stigma. We're talking about pelvic organ prolapse, or POP. Look, at the end of the day, this is a straightforward medical condition, plain and simple. And understanding exactly how it works, well, that's the very first step to destigmatizing it and finally getting some lasting relief. So what's our roadmap for this explainer? First, we'll cover understanding pelvic organ prolapse, then common risk factors, types and symptoms, diagnosing the condition, and finally, effective treatment options. Rest assured, we're going to walk through the mechanics and the solutions step by step. Section 1. Understanding pelvic organ prolapse, the mechanics of the pelvic floor. All right, let's dive right in. I want you to imagine your pelvic floor as a dynamic network of muscles, ligaments, and connective tissues. It essentially acts just like a hammock stretching right across the base of your pelvis. Its main job is to support some really crucial organs up there: the uterus, the vagina, the bladder, the urethra, and the rectum. But just like a physical hammock in your backyard, if those supporting ropes or the fabric start to become weak, stretched out, or damaged, well, whatever is resting safely inside is going to start dropping down.
Clinically speaking, POP is essentially a hernia. It's a condition where those pelvic organs protrude abnormally through that weakened tissue, dropping right down into or sometimes even outside the vagina. It's incredibly crucial to understand that this is a very, very common gynecologic issue, especially as women age. There is absolutely zero need for embarrassment here. It's simply physics and biology at work when supporting anatomical structures give way over time.
Section 2. Common risk factors. What causes the hammock to weaken? Now, here's the thing. Prolapse is rarely caused by just one single event. It's almost always a combination of life factors. Vaginal childbirth is a major trigger, particularly if you had a prolonged pushing stage of labor or a really high birth weight infant. Interestingly enough, the data shows that cesarean deliveries actually carry less risk for this than vaginal ones. Other major factors: increasing age, having obesity, a previous hysterectomy, or any other pelvic surgery. Oh, and chronic intra-abdominal pressure is a big one. That pressure can come from everyday things like repetitive heavy lifting, a chronic cough, or even chronic constipation. Over the years, all of these factors just slowly stretch out that pelvic hammock. Section 3. Types and symptoms. Identifying the prolapse. Okay, let's demystify some of this medical jargon, because you're definitely going to encounter it. Prolapse is categorized anatomically by which specific organ is dropping. So, if the front wall of the vagina is involved, it might be the bladder dropping, which clinics call a cystocele, or the urethra dropping, which is a urethrocoele. Now, on the back wall of the vagina, it could be the rectum protruding, known as a rectocoele, or the small intestine, called an enterocoele. And you know what? It's incredibly common for women to experience multiple types of these prolapses at the exact same time. The other two major types involve the uterus and the very top of the vagina. In a uterine prolapse, the uterus drops down into the vagina, and in really severe cases, known as persidentia, it can actually drop completely outside the body. Then there is vaginal or apical prolapse. This is where the top of the vagina actually drops down into the lower part. It's essentially turning the vagina inside out. As you can imagine, severe cases of this can cause some really significant pain when you're just sitting or walking. So what does this actually feel like in real life? Symptoms often include a distinct sensation of pelvic heaviness, fullness, or pressure. Many women report feeling a physical bulge right at the opening of the vagina. You might also experience urinary incontinence, which is just a medical term for leakage, or retention, where you feel like you just can't empty your bladder fully. There can be difficulty with bowel movements too. Sometimes this even requires a woman to physically press her fingers against the vaginal wall, a technique called splinting, just to be able to go. Finally, discomfort or pain during sexual activity is really common. Look, these symptoms can be understandably embarrassing to bring up, but I want to validate your experience right now and stress that they are highly, highly treatable. You know, there's actually a very distinct pattern to these symptoms. They typically get worse when you're standing upright, straining, or coughing. Why is that? Well, because gravity and that internal abdominal pressure are actively pushing down on your already weakened pelvic hammock. Conversely, these symptoms tend to completely disappear when you just lie down and relax, because you're physically taking all that pressure off the pelvic floor.
Section 4. Diagnosing the condition, the path to clarity.
Shifting gears over to the clinical side of things, you might be wondering, how exactly do doctors accurately diagnose pelvic organ prolapse and figure out just how severe it is? Well, the diagnostic process is actually pretty straightforward. A healthcare professional will perform a physical pelvic exam, generally using a speculum. But here is the key difference from your standard exam. They will likely examine you while you are bearing down, almost as if you're having a bowel movement, or while you're coughing. They might even check for vaginal bulges while you're standing up with one foot on a stool. This isn't just to be thorough. Doctors specifically need to check your pelvic floor under physical pressure to catch abnormalities that might completely vanish when you're just lying flat and relaxed on the table. They might also run separate tests on your bladder and rectum function just to get a complete, full-circle picture of how the prolapse is affecting your body. Section 5. Effective treatment options. The roadmap to relief. Okay, this is where we get to focus on your empowerment as a patient. Treatment for POP, it is absolutely a progressive ladder. Surgery is definitely not the first stop. We always start with step 1, observation, which is usually for those mild symptom-free cases. Step 2 is engaging in targeted pelvic floor muscle exercises. Step 3 involves inserting a supportive device called a pessary. And only then, at step 4, do we start considering surgery if your symptoms are persisting or just severely impacting your day-to-day life. Let's break down those exercises a bit, specifically Kegels. The technique here is to tightly squeeze the pelvic floor muscles, hold for 1 to 2 seconds, and then fully relax for 10 seconds, gradually building up your hold time. A fantastic trick to identify the exact right muscles. Try stopping your urine flow midstream. Now, if you struggle to find those muscles, please do not worry. Pelvic floor physical therapy is absolute gold for this. Therapists can use specific tools like cone-shaped inserts, biofeedback devices that actually let you see your muscle contractions on a computer screen, or even gentle electrical stimulation to help you locate and strengthen the exact right area. Now, if exercises just aren't quite cutting it, we can look at a pessary. A pessary is a removable, usually silicone device that gets inserted directly into the vagina. It essentially acts as a physical scaffold to support those dropped pelvic organs, beautifully easing your symptoms without any need to go under the knife. They come in all sorts of shapes, like diaphragms, cubes, or donuts, and your doctor fits them specifically to your body. They do require a bit of management. You have to periodically remove and clean them with plain soap and water, though your doctor can absolutely help you manage that routine if you aren't able to do it yourself. Finally, if those symptoms are still hanging around after trying exercises and a pessary, or if they're just super severe from the jump, surgery is a highly effective option. This is usually considered when a woman has decided she's not going to have any more children. The surgical approach can be abdominal, done via incisions in the abdomen, either a larger laparotomy or smaller laparoscopic incisions, or it can be vaginal surgery, which is done entirely through the vagina to repair those supportive tissues with absolutely zero external incisions. Depending on your specific case, procedures might involve repairing tissues, a hysterectomy to remove the uterus entirely, or for those who have severe prolapse and no longer plan to be sexually active, safely closing the vagina to ensure the prolapse never, ever comes back. I want to end this explainer with a core philosophy straight from our medical sources. Treatment of pelvic organ prolapse is based on a woman's symptoms. Treatment aims to improve quality of life. Relief is the ultimate goal here, and as we've seen, you have so many viable step-by-step options to get there. Thank you so much for joining me today. If you found this structured dive helpful, please be sure to hit that like button, share this explainer with anyone who might benefit from this knowledge, and definitely subscribe to the MediByte channel for more clear, visual medical explainers. So as you think about your own health or the health of someone you love, ask yourself, are we normalizing discomfort that could actually be solved today? Until next time, stay curious and stay healthy.